Hello AMP students, my name is Eric Barn, and today I'm going to be taking you guys through an example having to do with the rotator cuff muscles. So if you look at this problem, suppose you have a patient who comes into your clinic with rotator cuff weakness and pain. What are the muscles that are a part of the rotator cuff, and how might you diagnose which muscle or muscles are dysfunctional? So to explain this better, let's hop over to visible body. So let's first identify all of the rotator cuff muscles. Now there are 4 of them, and I'll try to give you guys a chance to name all of them right now before I keep going. Okay, so the way I like to remember these is with the acronym SITS. So the first S will be supraspinatus up top right here. Then the I will be infraspinatus. The T will be teres minor. And then if we look anteriorly, we can see the last S will be subscapularis right here. So if we turn back to this posterior view, we can start looking at the lines of pull and what exactly these muscles will do to the humerus. So first, let's start with that first S in the SITS acronym, which was supraspinatus. So if we look at the line of pull here, we can see that this muscle is going to be going from the supraspinous fossa here over to the greater tubercle of the humerus here. And we can see that this muscle will be performing adduction of the humerus because of its line of pull. Now, it won't be the prime mover in adduction, so we can say that it will initiate adduction of the arm. So to test this rotator cuff muscle, we might have our patient do an arm adduction exercise, and if they have trouble initiating that adduction, then we might suspect some damage to this supraspinatus muscle. So now moving on to your infraspinatus muscle, which is just inferior to that supraspinatus. So if we look at the line of pull here, we're going to be going from the infraspinous fossa and again over to the greater tubercle of the humerus. So if we look at this line of pull, we can see that infraspinatus will laterally or externally rotate the arm. So we can have our patient, again, do some sort of external rotation of the arm, and if they have trouble external rotating, we might suspect this muscle. Then moving inferiorly again, we have the teres minor, and this is going to be the most inferior of our rotator cuff muscles. So if you look at teres minor, it's going to be going from the lateral border of the scapula here, and then it will again insert into that greater tubercle. So we can also say that this muscle will perform external rotation of the humerus, just like the infraspinatus muscle. So again, we could have our patient try some external rotation, and then if it's weak or impaired, then we can suspect teres minor, or we could suspect infraspinatus. So now moving on to our last rotator cuff muscle, we'll rotate to an anterior view here, where we can see our subscapularis. So this muscle will be going from your subscapular fossa, and it will be inserting into your lesser tubercle of your humerus right here. And now if we look at the line of pull, we can say that this rotator cuff muscle will perform internal rotation or medial rotation. So to test this, we could have our patient do some exercise having to do with medial rotation. So to test this, we could have our patient do something having to do with medial or internal rotation, and if that is impaired, then we may suspect this muscle is injured. So now let's go over some of the nerves that are going to be innervating these rotator cuff muscles. So if I add the nerves here, we can see that there are 2 nerves that are going to be innervating your rotator cuff muscles, and we can start with this nerve right here called the axillary nerve. So the axillary nerve is actually a branch of the brachial plexus, which is originating in this area. And this will be innervating your teres minor, and this right here is your teres minor. And you can see how that nerve has some branches going to teres minor. Now this nerve will also be innervating the deltoid, which is why it just is kind of floating in space here. But if I added in the deltoid, then you could see that it innervates the deltoid as well. And then all of your other rotator cuff muscles are going to be innervated by the same nerve, and that will be your suprascapular nerve. So if I hide or fade both supraspinatus and infraspinatus, we can see vaguely right here, this nerve. I'll hide this one so you can see it a little better. This nerve right here will be your suprascapular nerve, the upper part of it, and then down here you will have the lower part of your suprascapular nerve. So if we suspect any damage to either of these nerves, either the axillary or the suprascapular nerve, we can do these tests that I mentioned earlier. And if some function is impaired or weak, then we might suspect some damage to either the nerve or the muscle itself. So that is all I wanted to talk to you guys about today. So thank you guys for listening and have a great rest of your week.